Depression is not just sadness, it is a far more serious condition. When a person feels depressed, it feels very hard to follow even the routine basic activities. Hello, my dear ones. I'm Dr. Kashika Jain. I'm a clinical psychologist. In this video, I will talk in detail about depression and how you can reactivate your behavior. But before I begin, I want you to download my mobile app. Just type my name, Dr. Kashika Jain. You will find my mobile app. Download it and experience meditation every day. It will boost your mood and you will easily come out from that depressive state. Now, let's understand what depression is all about. Depression is a serious mental illness. It is a state where a person persistently feels low mood, sadness. He doesn't feel like doing any activities related to work. Even it feels very hard to follow basic routine activities. Appetite changes, sleeping patterns changes. Persistently, a person may feel worthless, helpless, hopeless. It feels like that person is living in dark. That person isolated himself and doesn't take interest in any of the activities. That person used to participate in those activities, but now those activities are so hard for him to follow. It feels like a burden and he feels difficulty in concentrating onto something. He doesn't feel like hanging out with friends and showing very less interest in talking to even near and dear ones. It feels like that person is caged and now he's constantly thinking about something which happened in the past. That person may feel shattered, that person may feel hopeless. If that person loses hope to recover, it feels even more difficult because that person becomes suicidal. And a person is not taking any action because he doesn't feel like doing anything. So it feels very hard to come out of this depressive state naturally. Usually people take support of medicines, but medicines helps up to some extent. Most persons experience sleepiness when they take medications, but sometimes it's really important to take medications because if a person has suicidal tendency and not in a position to take even the psychotherapy sessions or not supporting in any way, then medicinal supports become important, necessary. But that's not a permanent long-term solution because medicines mostly works on symptoms, but what deep down that person feels, why that person is stuck into this state and why that person is feeling worthless, hopeless or helpless, what events still haunting him, why he is unable to shift his mental state, that all covers under the psychotherapies. If you meet any psychologist who is expert in conducting cognitive behavior therapy sessions and helps you in reactivate your behavior and motivates you and also sometimes do hand holding support to come out from this depressive state and along with CBT, hypnotherapy also helps a lot to break that depressive state because whatever you have been holding in your subconscious mind, hypnotherapy is a magical kind of therapy that helps to release those suppressed emotions and you feel somatically free because any trauma or any long-term feelings your body stores and it remembers even more than your mind. And sometimes you understand everything that I have to take some actions to recover, like I need to do exercises, I need to make changes in my diet, and I have to involve myself into some pleasurable activities so I feel normal, and I have to engage myself into some work so that something constructive I do, and gradually I shift my state. But even you know everything, you feel that as your body is not supporting you, you even motivate yourself, but your body surrenders. So that somatic release becomes so important. So hypnotherapy helps a lot. Likewise, you can use the emotional freedom technique, EFT, where you tap certain points in your body and you release stored feelings. And when your body releases all that traumatic experiences or your suppressed emotions, so your body starts supporting you, and whatever you think, you decide to take actions. So it feels so easy because your body supports you to take action, because whatever you think, to implement it, you need support from your body. And body and mind are not separate, they are one. So we are psychosomatic. So your mind affects your body and your body affects your mind. So you need to work upon both levels, because sometimes depression enters through your body. When you follow a very poor lifestyle, you don't eat healthy food, you eat lots of junk food, you wake up till late night, and you involve yourself into smoking, drinking, or you take drugs, lots of other lifestyle mistakes, poor lifestyle choices, if you keep following for long term. So naturally your body stops producing some happy, healthy hormones, and serotonin is mainly responsible for this. When serotonin levels are low in your body, and 90% of serotonin formation is within your gut. So your gut produces serotonin, and food association is so strong with your gut. Your food affects your mood. So when you have poor lifestyle, so your body stops producing the happy hormones, and without any such big event or any traumatic event, you suddenly start feeling disconnected from self, disconnected from environment. It feels like depersonalization, derealization. It feels like that you're losing interest in activities. You are feeling like staying isolated. You are losing interest in your work. You don't feel like hanging out with friends, and it feels like a burden. Your life is like a burden. Your body has no energy to move, and you just feel lying down on your bed and simply keep thinking, and you are in a zone where you are completely lost, and even you don't know what is actually bothering you. So sometimes your body reacts like this just because of your poor lifestyle, when you are abusing your body silently, slowly, or aggressively. So your body surrenders and your body doesn't support you. Then you feel depressed. And another gate of entering this depression is your mind. When some traumatic, painful events happened in your life and you could not handle some failure, somebody rejected you, like in love affair, if a person got rejected by other person, to that thing people take on their heart, and they start feeling that depressive state. And if someone loses the job, then also that person can go into that depressive state. Likewise, so many other reasons can be the responsible of a person entering into that depressing state. So it's okay to feel depressed for few minutes or hours, or for even 1-2 days, but if you don't change your thought process, if you don't change your actions, if you don't change your food and your lifestyle, you unknowingly maintaining that depressive state. And when you stop taking right actions, when you don't give proper meaning to what happened, you interpret that very like in a distorted way, then what happens, you unknowingly trigger your brain to maintain that state. It feels like that you have magnified your experiences. You are thinking in a catastrophic way. You are assuming for your future, and you are unable to accept what has happened. It feels like that you are lacking in acceptance, and you are simply replaying that event in your mind again and again. And the more you replay, it feels like that it's becoming more stronger in your mind. And after some time, it feels like that you cannot come out from that trauma. What happened doesn't matter. It came from your relationship issues, it came from your work area, it came from some other personal areas. It feels like that, oh, now I am stuck in this, and now I am helpless. I can't do anything. So understand, my dear, when someone is in depressive state, it feels like very hard to go for even a 10 minutes walk. It feels like a very big task to get up from the bed to go for a 10 minutes walk. Even the brushing the teeth, bathing, having food on time, the small routine activities feels like a big task. It feels like some other person, if they support us, then only I can take actions. So understand the importance of behavioral activation in this. Before I explain about the behavioral activation, let me inform you that I have already written a book on this, Dear Depression, Let's Break Up. And the core message is depression is nothing, just lack of expression. If you haven't read it, I recommend strongly to read this book because it's such an amazing self-help book. So yeah, coming back to my point, behavioral activation, because when a person is depressed, so they feel struggle to take even the small actions. But when you go for therapies, so your therapist motivates you to take actions, because your actions change your reality, your actions will change your mental state. Merely thinking about the positive outcome, it's not going to help you. So when you meet your therapist understands your condition and why you are into this depressive states, from where depression entered in your life. So they guide you and they prepare a customized plan for your recovery. So if you are stuck onto some events, then your therapist prepares you for radical acceptance. Your therapist helps you to release your somatic experiences. Your therapist motivates you, gives you hope, and prepare a customized program with you. How can you overcome from the challenges or develop the accepting attitude for whatever has happened? And also recommend some exercises, meditation, dietary, lifestyle changes, and also motivates you to take even the small actions. For example, if you don't feel like getting up, just motivate yourself to get up and just say, I will take only 10 rounds. So for some other person who is not depressed, it's a very, easy task. But for you, it's a tough task. So don't compare yourself with others or with your past. People usually do this mistake. They say, earlier I used to go for 1 hour walk and it was very easy for me. But now it feels like very hard for me to get up and go for a 10 minutes walk. I'm good for nothing. I can't do anything. I can't recover. This is only my destiny now. I should end my life. If you keep thinking this way, if you compare your life with that phase where you were absolutely fine, so that's really unfair. Or if you compare your life with other persons who are not depressed, that's also very unfair. You compare your change, your movements from your own current state. Say for example, today if you decide to go for a 10 minutes walk, and you complete your target, appreciate yourself, boost your confidence, reward yourself that I decided to go for a 10 minutes walk and I completed this activity task. So that appreciation, that motivation will help you to go next day for 15 minutes walk. So set very small goals, be specific, and take actions. Even when you don't feel like taking any action, just think and decide that I'm not feeling like taking actions, but when I actually take actions, I feel literally better. Just recall your experience when you really went for a walk. How did you feel? Earlier you were less interested or demotivated, but when you went there, you were grounded, you met people, and you took fresh air. So, after that experience, you felt literally better. So, recall that experience and understand the importance of taking actions, because you were not taking actions. So, you were blocking your recovery. For your recovery to change your mental state, you need to take actions. So the small actions are very important for your recovery. For example, you decided to take bath, you decided to take your food on time. If you are on medication, you decided to take your medications by yourself, or exercising, or journaling, or some artwork, or meeting one person per day and just randomly talking to that person, and going out for shopping or accompanying somebody. These small targets, when you set and you take proper actions, you take actually committed actions. So that helps you to come out from that depressive states, because when you explore new things, when you take different actions, so your brain receives different experiences, your body experiences something different, and when your body and mind receives different information, then they change their state. So initially it feels a very gradual process, and it feels like that it's very childish activities. Oh, it's very easy for people to do all these activities easily, naturally. But again, I am reminding you, don't compare your condition with those people who are absolutely fine. You compare your condition with yourself only. Understand you are depressed. So, recovery initially will be slow, but when you continuously take actions, so recovery speed becomes faster. And when you are again in active mode, you are taking proper actions, you are journaling your feelings, you are journaling your experiences, you are setting very specific goals, and you are appreciating yourself, rewarding yourself, and you are little bit pushing yourself and taking this responsibility that this is my life and I am responsible for it. My therapist can help me, my family members can help me, but I am the one who is responsible for my recovery, because anybody can show me path, but I am the only one who will walk on that path. So when you take this responsibility and when you value your life, that my life is really precious, and when you reinforce that feeling that I want to live, I want to live a very happy and healthy life, and when you explore your values, what is most important to you, just that experience that pushed you into this depressive state, was that so important. So instead of letting that experience keep you in this state, just understand that experience I felt to learn something valuable, and prepare yourself for radical acceptance. Say to yourself like this: I understand, I'm feeling depressed, I feel low, it feels a burden, or whatever your emotions are. Just acknowledge them and say, but I choose to move on. My life is precious, I am important. So that's how you accept the reality. If your depression came through such an event, you lost your job, you lost your girl or boy, or whatever, somebody died, or somebody insulted you, whatever has happened, so just accept that. And if depression entered through your body because of your poor lifestyle choices, then like correct all your lifestyle choices. So no matter it entered through body or mind, you have to make corrections in a holistic way. So when you constantly take right actions, like follow a good lifestyle, you do everything like this, and you take actions in your value areas, you start doing those activities which are of your interest, like you start pursuing your hobby and what is most important to you, you know your values, and you start focusing into your values area, and gradually you notice really now you're feeling much better, and every day it's like a progress. Every day you're becoming better version of yourself, every day you're feeling much better than yesterday. And also your therapist teach you how you can set those goals, and also through CBT your therapist makes you this clear that the way you think, it affects your mood and your actions, and how you feel, it also affects your thought process and your actions, and also your actions affects your emotional state and your thought process. So when you are depressed, you change your thought process, but just by changing your thinking, initially your emotions doesn't change. But when you change your thinking and you take action, so this new thinking and new committed actions changes your emotional state. So just changing your thought process initially doesn't help, but when you change your actions, you take committed actions along with your new thought process, then easily you change this depressive states. So keep this in mind. If I need to change, or I have to change this depressive state, and I wish to change this depressive state, then I need to adopt a new thought process along with committed actions. And that's the key to come out from depression. But when you don't take action, you simply experience meditation or practice affirmation, but deep down you have this thing in your mind that I can't recover, or I don't want to live anymore, I can't accept this, now I'm worthless, nothing will change in me, my life is ruined, nothing is left for me. If you have these kind of beliefs deep down holding in your subconscious mind, all these kind of beliefs will not allow you to recover. All the psychotherapies, medicines will fail, nothing will work on you. So understand, you need to have a positive mindset. You need to have a belief that I will recover. You need to have a faith in the process. You need to have patience, because when you're depressed, it takes time to change that state, because your mind deep down tries to protect you just because of your those kind of beliefs or some secondary gain which you are even not realizing, but you are experiencing that secondary gain. So just because of so many concerns, your subconscious mind initially doesn't allow you to change that state. But when you free your subconscious mind from those kind of negative limiting beliefs, and you take responsibilities for your recovery, then your subconscious mind allows you, rather supports you to change this state. So my dear ones, I hope this valuable video added some value in your life. A small request, kindly share this video with other persons so that we all together can help that person also. And if you haven't subscribed my channel yet, please subscribe. It means a lot to me. Like this video and leave a beautiful comment for me. I will see you in the next video. Till then, take care.